Hi, this is Dr. Young. We're talking about mole removals today in a live demonstration. I'm going to talk about the differences between excising and using lasers. When we excise moles, essentially what we need to do is incise the mole, and it entails making an incision with a scalpel, and then ultimately we're going to have to close that. So the positives of taking out the mole that way is that you avoid the chance of it coming back to a higher degree as opposed to using something like a laser. When you excise it, you actually cut out the whole mole, and it definitely takes a little margin around the mole so that the likelihood that it'll come back is much lower. But the drawback, of course, is that you make an incision and you're going to have a residual after effect of doing the incision. But if done well, that incision can heal really nicely. Now, the other alternative is to actually use a laser to take away the mole. And the benefit of using a laser is that you don't actually have to make an incision, you don't have to have sutures to take away or to close an incision with using a laser to remove it. However, using a laser does require a little bit more aftercare in terms of allowing it to heal. Essentially, it's an area that's denuded of your skin, and it takes a while for that to heal over. And there is some variability with the healing when it comes to using a laser. And there are some positive benefits in terms of the way it heals. Sometimes you can maybe lose a little pigmentation where the laser is applied. However, the benefits of using a laser is that you don't necessarily have to extend the incision to remove the mole. Using a laser, you can really take down the mole in the same size as the mole, whereas when you do an incision, you actually have to cut around it in a wedge-like fashion. I'm going to show you that right here. So over here, when we're talking about taking the mole, this is where we're planning to incise the mole, and as you can see, it's a wedge. And essentially, what needs to be done is we need to make an incision here and then close this. Now, the reason why we need to make it a wedge-like shape is because if we just cut around the mole and closed it, there will be puckering at the ends, which will stay for a very long time, if not indefinitely. And so to avoid those puckerings at the end, where if you were to just excise around the mole, we do an extension of that excision by making a wedge. So when it's closed, it's a little bit better adapted to the surrounding area, and it lays flat. Now, when you use a laser, you typically just laser that mole. But the end result is that the area that you take down with a laser is going to be sort of a raw area that will take time to heal. And essentially, your skin heals about 1 millimeter per day, which is about the thickness of that line. And that's at the maximal rate of growth. So it'll take about 5 up to 7 days for that to heal over. And that's probably one of the negatives when it comes to mole removal with a laser. So right now what we're going to do is we're going to excise this area, and then we're going to close this.